Hey guys, welcome back to Evidence MD, where you can ask any question about the human body and we look to scientific evidence for the answer. A question I've been getting a lot lately is, what is the flu? And I think this comes up a lot because we are right in the middle of flu season. I know this for a fact because over a third of my patients in the hospital right now have polymerase chain reactions that are positive for influenza virus. The flu is a respiratory tract disease characterized by sore throat, cough, runny nose, fever, diffuse body aches, and generalized malaise, or just extreme fatigue. In many respects, it's quite similar to the common cold, except that the symptoms tend to be much more severe. There are several ways to confirm diagnosis of the flu, but the best way is a laboratory test that demonstrates the presence of influenza RNA. Since the flu is caused by a virus, antibiotics have no effect in treating the disease. However, thankfully, there are antiviral medications. One of them is oseltamivir. But to be honest, it's not the greatest medication in the whole world. In general, it just will reduce the duration of the illness by a couple days. While the flu can be a serious infection, for most people it's self-limited and they'll eventually recover. However, for patients with multiple comorbidities or maybe patients with a more advanced age, the flu can be potentially life-threatening. So how can you protect yourself from getting the flu? Well, the best way is to get an influenza virus vaccine. There's one that comes out every single year and it's recommended for all adults. Aside from the vaccine, frequent hand washing is another good idea. And if you're around someone who you know is infected with influenza, wearing a face mask can also be a good protective measure. I hope this video was helpful in giving you some information about influenza. If you have any questions or comments, please feel free to leave them down below.